Children and adults alike can be concerned with the appearance of their teeth. Sometimes the appearance is to do with the position of the teeth, and sometimes it is to do with the colour of the teeth. In terms of the position of the teeth, at some points during development, the mismatch between the size of the jaw and the size of the teeth can mean that we have teeth that are not sitting in the right place. In that case, sometimes we do some interceptive orthodontic treatment. If the discrepancy is due to other issues, that would be discussed with your dentist. One of the frequent ones we see is shark teeth, which is when the baby teeth are still retained and the adult teeth are erupting behind them or in front of them. If your child has shark teeth, your dentist will assess them and decide whether or not we need to intervene to remove that baby tooth to allow the adult tooth to come into the correct position. In terms of discoloration, if your child has discolored baby teeth, this will be discussed with your dentist. Usually when we have discolored baby teeth, it is due to an underlying enamel defect. Enamel defects are discussed in a separate video, and you're welcome to watch those to understand more. But there are things that your dentist can do to help with that, including recommending certain toothpastes and certain pastes to put on your child's teeth to protect them, make them smoother and less retentive to stain. When it comes to our adult teeth coming through, sometimes children, when they have their adult teeth come through, can have some enamel defects which also cause discoloration. If that discoloration is severe, your dentist might recommend different types of treatment. For example, it might start from a simple EMS clean, which is a very nice polish of the teeth, which can remove some of the surface stains, or it could involve having some whitening treatment for those teeth, or even Icon, which is a resin infiltrant, which is like a sealant for the front teeth to make them shinier and stronger and less sensitive as well, and easier to keep clean. In some severe cases, following these steps, we might also mask the colour of the teeth by using different kinds of composite materials, which are tooth-coloured fillings. If you have any questions about this or any concerns, these will be discussed in your initial clinical appointment. If you want to have these discussed in front of your child, please indicate that you would like to do that. If you would prefer to speak privately about this, your clinician will ensure to be very discreet and speak to this separately. What I find is that when parents are concerned, they don't usually tend to discuss this in front of their children. Rather, we discuss it separately, and then the parent is armed with all the information they need so that going forward, if they did want to discuss with their child, they would know the information and what is available as a treatment option for their child.